So one of the less important parts of the emergency exam, but it can still be very important, is taking the blood glucose. So I'm not going to actually do it because it involves needles, and I can't do that without an instructor present. But I'll talk through it. The first thing I want to talk about is the normal levels. So the normal fasting level is going to be between 60 and 80. So if you're below that, but you've been fasting for about 8 hours, then you'll be okay. Then that's an okay level. If you're if you're an athlete and you're below 70, that's usually going to be kind of a point that you might want to pull them out and give them like a glucose tablet or something like that, just to boost up their blood sugar a little bit. If you're above 300, then you're going to be hyperglycemic, and you're going to need to make sure you pull them out. Otherwise, some bad things could happen there too. For applying it, you want to make sure you're wearing gloves because you're dealing with blood, and anytime there's blood involved, you have to wear gloves. Before you start anything, you want to make sure that you have an alcohol pad, a cotton swab, and the testing strip, and then the actual glucometer. So what you're going to do is you want to make sure you do a lateral part of your finger, because if you do anything on the inside or on the middle part, there's a lot more muscle there than there is on the lateral part. So you might not get as much blood, or you might hurt the patient doing it. So you want to rub the alcohol pad on it, make sure you dry it. You want to make sure it's not saturated, because if it's saturated, alcohol will get into the little prick, and it could sting the patient. So you want to wipe that up a little bit, and then you see there's this thing. This is the needle. You would just take this part off, and then you stick it, and just you want to just put a little pressure on it so it gets in there, and bring it out. So once you have the cut, or the prick, you want to squeeze it, make sure blood gets out there, and then you want to make sure you wipe away the first ones, priming it. So you want to wipe away the first one, and then you'll wipe that with the cotton swab like that, and then before you do anything, trying to put anything in, you squeeze it again. You want to make sure you get more blood out of there before it clots. And then after that, you take your glucometer, you put this thing in there. You want to make sure you put the chip in with the right way. You want to make sure you put it in the right way. And then when that does that, it turns this on. And then there's a little part here on the end of it, the little gray part there. You want to just get a little bit of blood. You don't want to saturate it. You want to just get a little bit of blood. And it'll bring it in, and then it'll give you your blood glucose level. And then after that, you wipe away the blood with the cotton swab, and then you can put a Band-Aid on if the patient needs it. So disposing of this goes in the sharps because it's sharp, and then the cotton swab and the thing can go in the garbage. There's not enough blood for it to warrant going into the sharps container, and then you're done.